Hey there, and welcome to your NCLEX Art and Preparation session. Get ready to take your exam preparation to the next level with these practice questions. On your screen, you'll see two main sections, the question on the left and the answer choices on the right. But here's where it gets interesting. I'll read each question out loud, and as I do, you'll see a red highlighter moving along, keeping you focused on exactly what matters. I'll show you why the correct answer is spot on, and we'll dive into why the other choices just don't fit. Plus, I'll share some pro strategies to help you tackle questions like a true NCLEX champion. Ready to crush it? Let's dive in. Before we dive into the practice session, let's see some important points regarding acid and base balance. Understanding these points is very essential to ace acid-base balance questions for your NCLEX RN examination. Arterial blood gas tests are crucial for assessing a patient's acid-base balance. They provide detailed information about the patient's respiratory status and metabolic function, which are vital for making informed clinical decisions. The arterial blood gas test measures several key parameters: pH, partial pressure of carbon dioxide, bicarbonate, oxygen saturation, and partial pressure of oxygen. Each parameter offers insight into different aspects of a patient's respiratory and metabolic status. The pH of the blood indicates whether the body is in an acidotic, where pH is less than 7.35, or alkalotic, where pH is greater than 7.45 state. This helps determine the overall acid-base status and guide appropriate treatment. EAC-2 measures the partial pressure of carbon dioxide in the blood. It is a primary indicator of respiratory function. Elevated partial pressure of carbon dioxide or hypercapnia indicates respiratory acidosis, whereas decreased partial pressure of carbon dioxide or hypocapnia indicates respiratory alkalosis. Bicarbonate acts as a buffer to maintain the blood's pH within the normal range. It is a metabolic component. Low bicarbonate suggests metabolic acidosis, while high bicarbonate indicates metabolic alkalosis. Oxygen saturation measures the percentage of hemoglobin that is saturated with oxygen. The normal range is 94 to 100%. This value helps assess how well oxygen is being carried to tissues throughout the body. Partial pressure of oxygen measures the partial pressure of oxygen in the blood. The normal range is 80 to 100 millimeters of mercury. This indicates the effectiveness of oxygen exchange in the lungs and the blood's oxygen-carrying capacity. Oxygen content refers to the total amount of oxygen in the blood, including both bound to hemoglobin and dissolved in plasma. Oxygen saturation specifically measures the percentage of hemoglobin bound with oxygen. Understanding this distinction is important for interpreting APG results. The normal reference ranges for arterial blood gas parameters bar. pH ranging from 7.35 to 7.45. Partial pressure of carbon dioxide ranging from 35 to 45 millimeters of mercury. Bicarbonate ranging from 22 to 26 milliequivalent per liter. Oxygen saturation ranging from 94 to 100%. Oxygen partial pressure ranging from 80 to 100 millimeters of mercury. Understanding these parameters and their normal ranges is essential for interpreting arterial blood gas results and diagnosing acid-base imbalances. Nurses use this information to develop appropriate care plans and interventions for their patients. Metabolic acidosis, which is indicated by decreased pH, partial pressure of carbon dioxide, and decreased bicarbonate. Metabolic alkalosis, which is indicated by elevated pH, partial pressure of carbon dioxide, and bicarbonate. Respiratory acidosis, which is indicated by decreased pH and elevated partial pressure of carbon dioxide and bicarbonate. Respiratory alkalosis, which is indicated by elevated pH and decreased partial pressure of carbon dioxide and bicarbonate. Respiratory acidosis. Respiratory acidosis is caused by an excess of hydrogen ions in the blood when the buffer system is insufficient. Hypoventilation is a major cause of this condition. Additionally, conditions that cause respiratory obstruction or airway inflammation can lead to respiratory acidosis. Clinical manifestations include hypoventilation, increased urine acid levels, drowsiness, seizures, dysrhythmia, headache, and coma. Nursing interventions to manage respiratory acidosis include suctioning, administering oxygen, and encouraging deep breathing and coughing. It is important to avoid prescribing opioids or respiratory depressants to treat restlessness in these patients. Respiratory alkalosis. Respiratory alkalosis is caused by hyperventilation of the lungs, where conditions that overstimulate the respiratory system lead to an excessive expulsion of carbon dioxide. This overstimulation can result in a variety of symptoms, including neuromuscular manifestations, tachycardia, dysrhythmias, lethargy, confusion, nausea, vomiting, and pain. To manage this condition, nursing interventions focus on calming the patient, employing the rebreathing technique, administering calcium gluconate, teaching relaxation techniques, and, in some cases, prescribing opioids. Metabolic acidosis occurs when there is an increase in acid or a loss of bicarbonates in the body. This condition can be caused by various factors, including kidney disease, diarrhea, and lactic acidosis. Patients with metabolic acidosis may exhibit symptoms such as hyperventilation, fatigue confusion, and cardiac arrhythmias. Nursing interventions for managing metabolic acidosis involve treating the underlying cause, administering bicarbonate, and monitoring electrolyte levels to ensure proper balance and function within the body. Metabolic alkalosis occurs when there is a significant loss of acid or an increase in bicarbonates in the body. This condition can be caused by excessive vomiting or the use of diuretics. Symptoms of metabolic alkalosis include confusion, twitching, and muscle weakness. Nursing interventions for this condition involve treating the underlying cause, administering chloride or ammonium, and monitoring electrolyte levels. By the way, the strategies we've been talking about in this video, those approaches for tackling tricky NCLEX questions and managing the different types of questions are actually taken straight from a resource I really recommend, the new NCLEX-R in Practice Question Bank. If you're looking for a great way to practice and apply those strategies, this book has over 700 questions that mimic the real exam format, and each one comes with detailed explanations that help you understand exactly why the correct answer is right and why the others aren't. It's a great way to reinforce the strategies we've been covering here today. This book is especially useful if you're struggling with the new next generation NCLEX format or just need a structured way to build up your confidence with daily practice. You'll find it's all about practicing smart, not just hard, and really honing your test-taking skills. So, if these strategies are helping you out, this book could be a solid next step to boost your preparation even further. Just thought I'd share that in case it's something you want to check out. You've got this. Let's start with a case study type question. You should expect to get at least 3 case study questions with 6 questions each or a minimum of 18 questions like this in the real exam scenario. The 65-year-old male patient was admitted with symptoms of shortness of breath, cough, and wheezing. His medical history includes smoking and asthma, which likely contribute to his current respiratory issues. Upon examination, the patient displayed noticeable difficulty in breathing and audible wheezing. The chest sounds were described as congested, with the presence of both wheezing and crackles. His vital signs revealed an elevated pulse rate of 120 beats per minute and low blood pressure of 90 by 60 mmHg. Additionally, his oxygen saturation was recorded at 88% while on room air, indicating inadequate oxygen levels. In the nurse's notes, it was observed that the patient exhibited significant shortness of breath and wheezing, which are consistent with acute exacerbations of asthma or potential chronic obstructive pulmonary disease. The congested chest sounds with wheezing and crackles suggest an accumulation of mucus or other obstructions in the airways. The elevated pulse rate and low blood pressure may be indicative of the patient's distress or possible underlying cardiac issues. The reduced oxygen saturation level further confirms a deficiency in the patient's oxygenation status. The physician has ordered several diagnostic tests and treatments to address the patient's condition. An arterial blood gas test is to be performed to assess the patient's acid-base balance and respiratory function. A chest X-ray will be conducted to evaluate the condition of the lungs and identify any possible pathological changes. Spirometry is ordered to measure lung function and determine the extent of airway obstruction. In addition, nebulization and bronchodilators are prescribed to alleviate the wheezing and shortness of breath by opening up the airways and improving airflow. The lab results from the arterial blood gas test reveal a pH of 7.25, indicating a state of acidosis. The partial pressure of carbon dioxide is 50 meters mHg, which is elevated, suggesting respiratory acidosis. The bicarbonate level is 20 milliequivalent per liter, which is slightly low, reflecting a possible metabolic component contributing to the acid-base imbalance. The oxygen saturation remains at 88%, highlighting ongoing hypoxemia despite the interventions. These findings guide the physician and nursing team in tailoring the appropriate treatment to stabilize the patient's condition and address the underlying causes of his respiratory distress. What condition does the patient have based on the arterial blood gas test results? The options for this question given in the screen are: Option A, respiratory acidosis. Option B, respiratory alkalosis. Option C, metabolic acidosis. Option D, metabolic alkalosis. I will give you some time to go through the question and the options. You can see the timer running on the upper right-hand corner of the screen, but if you need more time, you can pause the video as well. All right, time's up. Let me reveal the right answer to you. The right answer is option A, or respiratory acidosis. The patient's arterial blood gas test results show a low as 7.25, which indicates acidosis. The elevated partial pressure of carbon dioxide of 50 millimeters of mercury suggests that the acidosis is caused by decreased ventilation. The bicarbonate levels are below the normal range, which shows that the body is compensating for the acidosis. The oxygen saturation is also below normal, supporting the respiratory acidosis diagnosis. The patient's history of smoking and asthma further supports the diagnosis. This question was pretty easy. Let me take you to our next question. If you're watching this video and feeling the pressure of tackling those challenging NCLEX-RN case studies, you're not alone. But what if I told you that the strategies and tips we're discussing here are all pulled straight from a game-changing resource designed to take your exam prep to the next level? Actually, the strategies for the case studies in this video is taken from NCLEX-RN Case Studies Exam Practice Bootcamp. This book is packed with over 100 in-depth case study questions, each carefully crafted to bridge the gap between theory and real-world clinical practice. Whether you're dealing with anxiety or feeling unsure about the complexities of case studies, this book is the perfect way to transform fear into confidence. With a focus on first attempt success, this bootcamp will not only teach you the right answers, but also guide you through why other options don't make the cut, so you can learn from each mistake and grow stronger with every case. The author has helped countless students just like you conquer their NCLEX on the first try, and now you can benefit from their expertise too. So, if you're ready to boost your confidence, master those case studies, and head into your NCLEX exam prepared like never before, the NCLEX-RN Case Studies Exam Practice Bootcamp is your trusted companion. You can find it right now. The link of the book is given in the description below. What is the most likely diagnosis for the 65-year-old male patient based on the given information? The options for this question given in the screen are: Option A, chronic obstructive pulmonary disease. Option B, bronchitis. Option C, pneumonia. Option D, acute respiratory distress syndrome. Option E, asthma exacerbation. I will give you some time to go through the question and the options. You can see the timer running on the upper right-hand corner of the screen, but if you need more time, you can pause the video as well. All right, time's up. Let me reveal the right answer to you. The right answer is option A, or chronic obstructive pulmonary disease, and option E, or asthma exacerbation, are the correct answers. Option A, chronic obstructive pulmonary disease, is a likely diagnosis based on the patient's history of smoking and asthma, symptoms of shortness of breath, wheezing and cough, chest sounds congested with wheezing and crackles, and elevated pulse rate. Option B, bronchitis, is not a likely diagnosis as the patient's symptoms, such as shortness of breath, elevated pulse rate, and low blood pressure, suggest a more severe condition than just bronchitis. Option C, pneumonia, is not a likely diagnosis as the patient's chest sounds congested with wheezing and crackles, which is not a typical sign of pneumonia. Option D, acute respiratory distress syndrome, is not a likely diagnosis as the patient's arterial blood gas results do not meet the criteria for a RDS. Option E, asthma exacerbation, is a correct answer as the patient has a history of asthma and is showing symptoms of wheezing and shortness of breath. The physician's order of nebulization and bronchodilators also supports this diagnosis. This question was pretty easy. Let me take you to our next question. What is the primary cause of respiratory acidosis? The options for this question given in the screen are Option A, hypoventilation. Option B, pneumonia. Option C, brain trauma. Option D, emphysema. I will give you some time to go through the question and the options. You can see the timer running on the upper right-hand corner of the screen, but if you need more time, you can pause the video as well. All right, time's up. Let me reveal the right answer to you. The right answer is option A, hypoventilation. Respiratory acidosis is caused by hypoventilation, which is when the lungs cannot exchange carbon dioxide with the environment due to airway or ventilation obstruction. This causes the excess carbon dioxide to combine with water to form carbonic acid, leading to an increase in hydrogen ions in the blood and a drop in the pit level. Other conditions such as pneumonia, brain trauma, and emphysema can also cause respiratory acidosis, but hypoventilation is the primary cause. This question was pretty easy. Let me take you to our next question. What could be the clinical manifestations of respiratory acidosis? The options for this question given in the screen are Option A, seizures, warm and flushed skin, and decreased blood pressure. Option B, drowsy and dizzy, headache, and coma. Option C, tetany, numbness, and seizures. Option D, deep and rapid respiration. I will give you some time to go through the question and the options. You can see the timer running on the upper right-hand corner of the screen, but if you need more time, you can pause the video as well. Answer: B. Drowsy and dizzy, headache, and coma. The clinical manifestations of respiratory acidosis are related to the increase of carbonic acid in the blood, leading to hyperventilation. The compensatory mechanism of the kidneys retaining bicarbonate and excreting excess hydrogen ion can cause the patient to feel drowsy and dizzy, have a headache, and even go into a coma. Seizures, warm and flushed skin, and decreased blood pressure are also symptoms, but not specific to respiratory acidosis. Tetany, numbness, and seizures are the symptoms of respiratory alkalosis. Deep and rapid respiration is the symptom of metabolic acidosis. This question was pretty easy. Let me take you to our next question. What is the main cause of metabolic alkalosis? The options for this question given in the screen are A. Excessive diarrhea, B. Diabetic ketoacidosis, C. Excessive vomiting, D. Kidney disease. I will give you some time to go through the question and the options. You can see the timer running on the upper right-hand corner of the screen, but if you need more time, you can pause the video as well. The main cause of metabolic alkalosis is C. Excessive vomiting. This occurs due to the loss of acid through increased bicarbonate ion concentration in the blood. Other causes include diuretics and citrate toxicity during massive transfusion of whole blood. This question was pretty easy. Let me take you to our next question. If the condition is caused by excessive vomiting that leads to increase in bicarbonate ion concentration in blood, what is the condition? The options for this question given in the screen are Option A. Respiratory alkalosis. Option B. Respiratory acidosis. Option C. Metabolic acidosis. Option D. Metabolic alkalosis. I will give you some time to go through the question and the options. You can see the timer running on the upper right-hand corner of the screen, but if you need more time, you can pause the video as well. Correct answer, D. Metabolic alkalosis. Metabolic alkalosis is the condition caused by excessive vomiting that leads to increase in bicarbonate ion concentration in blood. This increase in bicarbonate ion concentration leads to loss of acid in the blood and results in metabolic alkalosis. Other causes of metabolic alkalosis include diuretics and citrate toxicity during massive transfusion of whole blood. This question was pretty easy. Let me take you to our next question. After this case study question, let's do some more practice questions. A patient has been diagnosed with respiratory acidosis based on an arterial blood gas test. Which of the following is likely to have caused the acidosis? The options for this question given in the screen are Option A, damage to the alveoli. Option B, hyperventilation. Option C, normal carbon dioxide levels in the blood. Option D, high oxygen saturation in the blood. I will give you some time to go through the question and the options. You can see the timer running on the upper right-hand corner of the screen, but if you need more time, you can pause the video as well. All right, time's up. Let me reveal the right answer to you. The right answer is option A, damage to the alveoli. Respiratory acidosis is caused by excess carbon dioxide in the body, which can occur when there is damage to the alveoli, resulting in a decreased ability for carbon dioxide to escape from the body. When there is damage to the alveoli, it can lead to an excess of carbon dioxide in the body that can react with water to form carbonic acid, causing an acidic environment. Option A, damage to the alveoli, is therefore the most likely cause of the acidosis in this case. Option B, hyperventilation, would actually cause respiratory alkalosis, and option C, normal carbon dioxide levels in the blood, and D, high oxygen saturation in the blood, are not relevant causes of respiratory acidosis. I hope you solved this one correctly. Let's solve the next question. Mrs. Daniel has been diagnosed with respiratory acidosis and has an arterial blood gas test showing the following results. 7.25 partial pressure of carbon dioxide, 50 millimeters of mercury, bicarbonate 18 milliequivalent per liter, oxygen saturation 95%, and partial pressure of oxygen 90 millimeters of mercury. The question is, what is the most likely cause of her respiratory acidosis? The options for this question given in the screen are Option A, hyperventilation. Option B, damage to the alveoli. Option C, low oxygen in the hemoglobin. Option D, acidic environment in the body. I will give you some time to go through the question and the options. You can see the timer running on the upper right-hand corner of the screen, but if you need more time, you can pause the video as well. All right, time's up. Let me reveal the right answer to you. The right answer is option B, damage to the alveoli. Respiratory acidosis can occur when there is damage to the alveoli, resulting in excess carbon dioxide in the body that reacts with water to form carbonic acid and creates an acidic environment. The arterial blood gas test results indicate that the patient has a peat level of 7.25, which is lower than the normal range of 7.35 to 7.45. This suggests that the patient is experiencing acidosis. The increase in partial pressure of carbon dioxide and the decrease in bicarbonate, 18 milliequivalent per liter, which is lower than the normal range of 22 to 26 milliequivalent per liter, are both consistent with respiratory acidosis. The normal range for partial pressure of oxygen is 80 to 100 millimeters of mercury, and the patient's partial pressure of oxygen level of 90 millimeters of mercury is within this range, indicating that their oxygen saturation is normal. Therefore, the most likely cause of the patient's respiratory acidosis is damage to the alveoli, which is preventing them from effectively exhaling carbon dioxide. I hope you solved this one correctly. Let's solve the next question. A patient with a lung disease has an arterial blood gas test performed and the results show up as 7.20, partial pressure of carbon dioxide of 60 millimeters of mercury, and bicarbonate of 20 milliequivalent per liter. The question is, based on the arterial blood gas test results, what is the patient's acid-base balance condition? The options for this question given in the screen are Option A, acidosis. Option B, alkalosis. Option C, normal. I will give you some time to go through the question and the options. You can see the timer running on the upper right-hand corner of the screen, but if you need more time, you can pause the video as well. All right, time's up. Let me reveal the right answer to you. The right answer is option A, acidosis. The P of the patient's blood is 7.20, which is lower than the normal range of 7.35 to 7.45. The partial pressure of carbon dioxide is also higher than the normal range of 35 to 45 millimeters of mercury. These values indicate that the patient's acid-base balance is in an acidotic condition. A paint value lower than 7.35 indicates acidosis, and a partial pressure of carbon dioxide value higher than the normal range can also indicate acidosis, particularly in the case of a lung disease where carbon dioxide cannot escape the body properly. The bicarbonate value of 20 milliequivalent per liter is lower than the normal range of 22 to 26 milliequivalent per liter, which can also contribute to acidosis. Therefore, based on these arterial blood gas test results, the patient's acid-base balance is in an acidosis condition. I hope you solved this one correctly. Let's solve the next question. A patient with a lung disease is experiencing difficulty breathing and has an arterial blood gas test done. The results show up as 7.2, partial pressure of carbon dioxide of 60 millimeters of mercury, bicarbonate of 20 milliequivalent per liter, oxygen saturation of 90%, and partial pressure of oxygen of 70 millimeters of mercury. The question is, based on the results of the arterial blood gas test, what is the patient's acid-base balance condition? The options for this question given in the screen are Option A, acidosis. Option B, alkalosis. Option C, normal. Option D, cannot be determined. I will give you some time to go through the question and the options. You can see the timer running on the upper right-hand corner of the screen, but if you need more time, you can pause the video as well. All right, time's up. Let me reveal the right answer to you. The right answer is option A, acidosis. The results of the arterial blood gas test indicate that the patient has acidosis, as the PACE below the normal range of 7.35 to 7.45 and the partial pressure of carbon dioxide is above the normal range of 35 to 45 millimeters of mercury. The PEV of the blood is a measure of its acidity or basicity. A PEV below 7.35 indicates acidosis, while a PEV of 7.45 indicates alkalosis. The partial pressure of carbon dioxide is a measure of the amount of carbon dioxide in the blood and how well it can move out of the body. An elevated partial pressure of carbon dioxide can contribute to acidosis. I hope you solved this one correctly. Let's solve the next question. A 45-year-old male patient presents with symptoms of shortness of breath, dizziness, and a headache. His blood pressure is low and he is feeling drowsy. Upon examination, it is determined that the patient has respiratory acidosis due to pneumonia. What is the main cause of respiratory acidosis? The options for this question given in the screen are Option A, hypoventilation. Option B, pneumonia. Option C, bronchitis. Option D, brain trauma. I will give you some time to go through the question and the options. You can see the timer running on the upper right-hand corner of the screen, but if you need more time, you can pause the video as well. All right, time's up. Let me reveal the right answer to you. The right answer is option A, or hyperventilation. The main cause of respiratory acidosis is hypoventilation, which occurs when the lungs do not exchange enough carbon dioxide with the environment. In this case, the patient's symptoms and examination results suggest that the cause of the respiratory acidosis is pneumonia, but pneumonia is not the main cause of the condition. Respiratory acidosis is a condition in which there is an excess of hydrogen ions in the blood that cannot be absorbed by the buffer system in the blood. This usually occurs when there is alveolar hypoventilation, which is a reduction in the amount of air being exchanged in the lungs. Other causes of respiratory acidosis include airway obstruction or ventilation obstruction, such as pneumonia, bronchitis, asthma, pulmonary edema, COPD, and emphysema. I hope you solved this one correctly. Let's solve the next question. A patient is brought to the emergency department with symptoms of respiratory acidosis. Upon examination, the patient is found to have a fever and congestion in the lungs. The patient's blood gas analysis shows a F7.25 and a partial pressure of carbon dioxide of 60 millimeters of mercury. The patient is experiencing seizures and dizziness. Which of the following is a symptom of respiratory acidosis? The options for this question given in the screen are Option A, tetany. Option B, numbness. Option C, seizures. Option D, warm and flushed skin. I will give you some time to go through the question and the options. You can see the timer running on the upper right-hand corner of the screen, but if you need more time, you can pause the video as well. All right, time's up. Let me reveal the right answer to you. The right answer is D. Respiratory acidosis is caused by alveolar hypoventilation, leading to an excess of carbonic acid in the blood. Symptoms of respiratory acidosis may include warm and flushed skin, as well as seizures and dizziness. Tetany and numbness are symptoms of respiratory alkalosis, which is caused by hyperventilation of the lungs. Respiratory acidosis is a condition in which there is an excess of hydrogen ions in the blood, leading to an acidic pate. This can be caused by conditions that obstruct ventilation or airflow, such as pneumonia or bronchitis. In response to respiratory acidosis, the kidneys will compensate by retaining bicarbonate and excreting excess hydrogen ions in the urine. Symptoms of respiratory acidosis may include hypoventilation, an increase in urine acidity, seizures, warm and flushed skin, decreased blood pressure, dizziness, drowsiness, headache, and coma. It is important to provide oxygen and encourage deep breathing and coughing to help clear the airway in cases of respiratory acidosis, and to avoid prescribing respiratory depressants or opioids, which could worsen the condition. I hope you solved this one correctly. Let's solve the next question. A patient brought to the emergency department upon examination is experiencing hyperventilation and is anxious and agitated. The patient's blood gas analysis shows a F 7.55 and a partial pressure of carbon dioxide at 30 millimeters of mercury. The patient is experiencing tetany, numbness, and seizures. Which of the following is a cause of respiratory alkalosis? The options for this question given in the screen are Option A, pneumonia, Option B, bronchitis, Option C, anxiety, Option D, pulmonary edema. I will give you some time to go through the question and the options. You can see the timer running on the upper right-hand corner of the screen, but if you need more time, you can pause the video as well. All right, time's up. Let me reveal the right answer to you. The right answer is C. Respiratory alkalosis is caused by hyperventilation of the lungs, which can be triggered by various factors such as anxiety, panic, fever, pregnancy, certain medications, and certain medical conditions. Pneumonia, bronchitis, and pulmonary edema, on the other hand, are all causes of respiratory acidosis. Respiratory alkalosis is a condition in which there is a decrease in carbonic acid in the blood, leading to an alkaline pate. This can be caused by overstimulation of the respiratory system, which leads to hyperventilation and an excess of carbon dioxide being exhaled. Causes of respiratory alkalosis can include anxiety, panic, fever, pregnancy, certain medications, such as aspirin or salicylates, and certain medical conditions, such as diabetic ketoacidosis or damage to the brainstem. Symptoms of respiratory alkalosis may include hyperventilation, tetany, numbness, seizures, and confusion. It is important to identify and address the underlying cause of respiratory alkalosis and to provide oxygen and other supportive care as needed to help regulate the pH of the blood. I hope you solved this one correctly. Let's solve the next question. A patient is brought to the emergency department with symptoms of respiratory alkalosis. Upon examination, the patient is experiencing anxiety and hyperventilation. The patient's blood gas analysis shows a of 7.55 and a partial pressure of carbon dioxide of 35 millimeters of mercury. The patient is experiencing tetany and numbness in the hands and feet. Which of the following is a cause of respiratory alkalosis? The options for this question given in the screen are Option A, pneumonia. Option B, asthma. Option C, anxiety. Option D, pulmonary edema. I will give you some time to go through the question and the options. You can see the timer running on the upper right-hand corner of the screen, but if you need more time, you can pause the video as well. All right, time's up. Let me reveal the right answer to you. The right answer is option C. Respiratory alkalosis is caused by hyperventilation of the lungs, leading to a decrease in carbonic acid and an increase in pH. Causes of respiratory alkalosis may include overstimulation of the respiratory system, such as anxiety or panic, as well as hyperthermia, pregnancy, certain drugs, and conditions such as diabetic ketoacidosis or hysteria. Pneumonia, asthma, and pulmonary edema are causes of respiratory acidosis, not alkalosis. Respiratory alkalosis is a condition in which there is a decrease in carbonic acid and an increase in pH due to hyperventilation of the lungs. This can be caused by various factors, including overstimulation of the respiratory system, such as anxiety or panic, as well as hyperthermia, pregnancy, certain drugs, and conditions such as diabetic ketoacidosis or hysteria. Signs and symptoms of respiratory alkalosis may include tetany, numbness, seizures, and other neuromuscular symptoms, as well as dizziness, headache, and confusion. Nursing interventions for respiratory alkalosis may include encouraging the patient to slow their breathing and try relaxation techniques, addressing the underlying cause of the alkalosis, and in severe cases, administering oxygen or other interventions to restore normal oxygen levels in the blood. Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX RN. I know how stressful it can be, especially when you're balancing everything: clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX RN questions and answers practice guide. It's a taken for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and, most importantly, help you feel more ready. Good luck. You've got this.